My name is Federick-Williams, and for the Black Resilience Project, I will be discussing the impact of reproductive health inequities on Black women. To begin, I will start by reading an excerpt or an anecdote from the experience of a Black woman during childbirth. This is found in an article on gendered racial trauma and childbirth trauma. The doctor came in the room in a hush. Without even looking at me, he told me to lie down and spread my legs. I remember thinking something about this doesn't feel right, but I was confused. I never did this before. Maybe that was normal. I was in pain. I was scared. The contractions were so strong, and they were getting closer and closer together. I was desperate for them to stop. Next thing I know, there were what seemed like 20 people in the room, all men, all white. Without asking me first or telling me what was about to happen, they took turns inserting their fingers in me to check my dilation and discussing amongst themselves the numbers. They all talked to each other like I wasn't in the room. I finally said, "I'm not comfortable with all these people in the room." The doctor snapped back at me, not to be difficult and that he had a right to have medical students in the room because it's a teaching hospital. I felt violated and angry, but I was dependent on this man to get me through this. I didn't know what I was doing. I was afraid of dying or something happening to the baby, so I stayed quiet and went along with what he told me to do. I still have nightmares about him hovering over me, and I wake up in sweats. It's true. I didn't know what to expect exactly, this being my first baby, but I know it wasn't this. Stark and perpetual health disparities impact Black women more than most women of other ethnic backgrounds. The reproductive health of Black women is particularly affected by racial health inequities. Racism fosters these reproductive health inequities through stereotypical depictions of Black women and healthcare professional bias and discrimination. As a result of reproductive health inequities, Black women experience medical mistrust, underutilization of healthcare, and psychosocial stress. Stereotype threat is highly prevalent within the medical community and is just one social barrier that contributes to the various health disparities among Black women. Stereotype threat is defined as the threat of being judged by or conforming to negative group-based stereotypes. Examples of stereotypes that affect Black women are the strong Black women stereotype that asserts Black women cannot feel pain, the Jezebel stereotype that asserts that Black women are hypersexual, promiscuous, and seductive. Black female patients are non-compliant, aggressive, and dominant. Black female patients are young, single, and have children to go on public assistance, known as the welfare queen. And Black women are lazy, uneducated, and irresponsible. These stereotypes serve to suppress and invalidate the feelings and concerns of Black women during childbirth in order to maintain racism and discrimination in the healthcare system. Healthcare professionals hold implicit biases and or explicit stereotypes that influence the quality of care Black women receive. Consequently, medical professionals are more likely to dismiss, scold, or ignore the requests, concerns, or preferences of Black women during childbirth. The neglect and dismissiveness of Black women during childbirth is a prime example of invisibility syndrome. Invisibility syndrome refers to maternal and health consequences that result from being perceived through the lenses of stereotypes in every aspect of Black women's lives. Additionally, Black women are 3 to 4 times more likely to experience dangerous and even life-threatening complications and more likely to report mistreatment and neglect from medical providers and staff during childbirth. Black women also have the highest rate of adverse birth outcomes such as preterm birth, preeclampsia, cardiovascular disease, and tragically infant mortality of all major racial ethnic groups in the United States. As a result of stereotypes and professional bias and discrimination, Black women engage in several strategies to protect their reproductive health. These self-protective actions include seeking a healthcare professional of color, over-preparing for their appointments, enlisting advocates, seeking care only when desperate, or heightening symptoms to be heard. There are various strategies that Black women use to promote healthy functioning or there are there are strategies that can be used to promote healthy functioning and well-being of Black people in America. The pro-Black perspective, which focuses on the African American experience and the psychological consequences of being Black in America, can be implemented to promote healthy functioning and well-being of Black Americans. One example of a pro-Black approach to decreasing racial health disparities is uniform healthcare for all. Uniform healthcare would decrease some of the economic barriers that prevent Black women from equal access to healthcare. Another example of a pro-Black approach to decreasing racial health disparities is psychotherapy. Psychotherapy can help Black mothers process gendered, racial, and childbirth traumas by offering them therapeutic support and advocacy. The Black Mamas Matter Alliance is an example of a form of resilience for Black women. It is a Black women-led cross-sectoral alliance that centers Black mamas and birthing people to advocate, drive research, build power, and shift culture for Black maternal health rights and justice. The anecdote provided at the beginning of the presentation is just one example of the Black woman's experience in healthcare. Childbirth in itself is a traumatic experience, but for Black women, the intensity of the trauma is heightened to an unimaginable magnitude. As previously reported, the psychological effects of racial health inequities and stereotype threat on Black women are universal and persistent. A system that was designed to treat, support, and heal people neglects and mistreats Black women who are disproportionately affected by childbirth complications and reproductive health inequities. In spite of such challenges, Black women affected by such inequities remain resilient. These are a list of the references I used to find the data supporting the racial and health inequities of Black women. Thank you.